Hey guys, I was just gonna give you guys a little heads up about should you get shoulder surgery. So here's what happened to me about 2 years ago, 2.5 years ago. I was on the bench press. I heard something tear. It was really bothering me. I went to see a surgeon. They did an MRI. They looked at it. Oh, he doesn't think it's that bad. Do some exercises. Went back. It was bothering me. Um, and then they wanted to do a shot. This was in 2020, and I really didn't want to do a shot. So I waited another year. Shoulder's not getting better. I could barely bench press a 25 on each side, which for me is like should be super easy. And I laid off of it for a long time, probably like 4 or 5 months, not getting better. Went back to see him. They want another MRI. It's been a year, so I get another MRI. So there's almost a full tear in the tendon. Okay, is what he says. I read the MRI. I looked up all the words on the internet. Blah blah blah. It's like 3/4 of a thickness tear. This guy doesn't really want to do surgery. He's not like pushing me towards it. I got decent mind. If it's torn, it's not going to repair itself, and the shot's just going to mask it. So I did do the shot. Shot lasted, cortisone shot lasted like 3 weeks. All it did was like mask the pain, and I was just like, that's what I thought I was going to do anyways. So, um, oh, I did go get a second opinion, and that surgeon said, yeah, he looks like it's almost a full tear. And he goes, and I was like, well, what would you do? And he like made a little drawing, and he showed me like what an anchor looks like. And he's like, oh, I threw a couple anchors in there. And I was like, okay. Excuse me. So again, it's not getting better. This has been going on for 2 years. And I've got pain radiating down my arm. I've been doing the band exercises. It's not working. I was having a lot of pain in the front of my shoulder too. Like here's my bicep, here's my pec, like right here. It was killing me. I even bought one of these, massage gun. I was like, trying to get the pain out. Um, so I went to have the surgery done it's been like 7 weeks now. And the second surgeon, he went in there and he said that, after I saw him after surgery, he said we did a lot of work in there. And he said that the tear was actually much bigger than the MRI showed. So, that's as best as they can do, with an MRI is read the MRI, but it's not like looking at the actual inside the body, right? So they, so I had a full tear, it was almost 3/4 of the way across the tendon of the supraspinatus, the top one. I had two partial tears, partial tear in the front, partial tear in the back. I had a synovectomy. I guess I had like fluid buildup. I don't really know what that means, but they like pulled that out of there. And then I had I think it's like a acromial decompression. So they shaved out all the bone spurs and stuff. And so here's the whole reason I'm making this video right now is like if you're having a lot of pain, because here's what I noticed was like a lot of these surgeons, they really were not pushing me towards surgery. Okay. Even the second guy, he was just like, he's like, if you want me to do it, he's like, here's what I would do. And so I told him that, I'm sorry, I'm watching the Michigan football game right now. Michigan, Ohio State is scoring a touchdown. Michigan just scored. So I'm a Michigan fan, so I had to take a break from my video here. But anyways, like, what I want you guys to know is like if you're really having a lot of pain, you should listen to that. But the reason I think these surgeons aren't pushing people into doing shoulder surgery is because this is 7 weeks. I was in a sling. I couldn't move my shoulder. it was like strapped. I mean, it was like, strapped like that. I couldn't do anything. And then there's also the risk, if you're not careful, you could wind up with, tearing the sutures, right? Like if you're not a good patient, if you're not following the orders. I mean, trust me, there were times where, you know, 6 weeks of not using your arm. I mean, think of what that's like. I mean, it's really difficult to get dressed. Pull your pants up with one arm, lay down, try to get the button, with one hand, or, sometimes I would take my sling off, lay down, and then, be able to use two hands. So I think a big reason, unless it's like really severe, that they're not just pushing people into shoulder surgery, is because of the recovery. I mean, I'm 7+ weeks, and I can barely, like this is my good arm. I could probably get my arm like 75% up. I can't pick anything up aside from, they said a milk jug is too much. I'm not supposed to be, whipping my arm to the side. And just yesterday, they gave me some new exercises where I'm like, crawling my fingers up the wall. Um, and another one is like I can do little circles laying on the ground with my fists. And so here's my conclusion. And I've had a lot of orthopedic surgery. This was my 14th surgery. I had one accident where I was in the hospital for like 3 months, healing from like, 3 broken limbs, broken back. By God's grace, I've recovered from all this stuff, and I've been through a lot, of other stuff. But I'm telling you, like, this surgery is like incredibly, incredibly not like crippling, but like as far as your daily routine, I mean, it's not coming back in like a month, 2 months. Some of the recovery times are like 9 months, to full activity. Like I could go back in the weight room and just grab whatever I want and, or whatever I could do and just push it. So take that into consideration, if, because some of this has to do with how much pain you're in and what kind of quality of life you have. I was like, I mean, I like lifting weights and it's good for me. It helps get rid of stress, makes me feel good. I feel healthy. I sleep better. So for me, it was worth it. I was just like, well, I'm just going to do it. And neither of my surgeons were pushing me in there. So I want you to remember too, they can only see so much from that MRI. So, you have to weigh that. You have to weigh all, because then they say, well, they'll look around in there and see, what's going on. If there's any other work, they'll just do that, because they were going to do a biceps. I think it's called a biceps tendinosis or something. And he said he got in there and he looked, and my biceps tendon was okay. But I'm telling you, like right here, I can't even tell you how much pain I was having. So, probably some of that was from not stretching properly, overworking my chest, not doing rotator cuff exercises, because rotator cuff's a small muscle. It's not a big weight. Most people are just like, bigger weight, better. But I guess it's really important that you guys, exercise that. So now I was able to swim with no problem. I mean, I could go in and swim 20, 30 laps, no problem. That was not bothering me, but I did want to get back into weight. So I just want you guys to know, like, the recovery it's no joke. It's, it's not like, hey, just hop right back into everyday life. So, weigh all those things when you go to have surgery. So a big takeaway is they were supposed to do 2 things in my surgery, and they wound up doing 5. So, I'm 7.5-ish weeks post-op, and I feel pretty good. I mean, it's tight. Some of this physical therapy I started the other day has been painful. I mean, I did 15 minutes of ice, at the PT after after my last visit. But they're pushing on it pretty hard because the tendon is stronger right now. They say at like 2 to 2 to 5, or I'm sorry, they say at like 8 weeks the tendon's healed, and then you can start doing like light strength, like light resistance, active movement, light. So I'm getting close to that, but I would just encourage you guys. I think like this was not that painful for me because I've had a lot of other surgery, and I think I have like a high pain threshold because I have a friend that just had the same exact surgery 2 days before me, and she had her biceps tendon, where they cut it and they reattached it, and she's been in a lot more pain, but she hasn't, been through a lot of surgeries and stuff. So maybe I just have a higher tolerance of pain. But guys, just keep up the good work, and I would just recommend whatever they tell you to do it. Don't try to do more, because if you bust it, you spend all that money for the surgery, you're doing the surgery to get better. And then, I mean, it was tempting to start picking stuff up, trust me, or just like start doing things I shouldn't have been doing. But, as long as you follow the protocol, the surgeon told me after the surgery when I went to see him, he said we have a really good success rate with this, for whatever they did. So I want you guys to be encouraged, take walks, whatever you need to do to like keep, your brain in the right spot. Because, I mean, I was getting kind of depressed too, being in that sling. I mean, I'm used to being really active, and I could walk, and I mean I could get on the stair climber, or, do the leg press, but that was about it. There was just not much more I was able to do. So, you know, and I would just get it done too. I mean, I live in the United States of America, and like I don't really think good things are coming. Healthcare is getting just ridiculously expensive. Even my surgeon, like I feel like I have a really good surgeon. Like calling the surgeon, I had questions. Sometimes they wouldn't respond, you know, just because of the staffing issue or whatever. So just remember that too, and good luck with whatever decision you make. I'm just sharing this so that you guys understand like what I've been through. I do plan on getting in the swimming pool at 4 months. My doctor said I could get in the pool. At 4 months, I can start swimming. So from all my other injuries, I want you to see that scar right there underneath. I really broke my arm bad when I was about 25 years ago in an auto accident, and swimming was what was able to get me back into into fitness, and I am able to lift weights and stuff, but it'll get your strength back, and you're gonna probably gain more range of motion. If you're not a good swimmer, I would recommend getting a snorkel and a mask and some fins, and that way you can just concentrate on the exercise. You're not gonna have to worry about the breathing. So I hope you guys have a great day, whatever you're doing. Hopefully this video encourages you. I just want to share my experience and why I made a decision to get the surgery. Bye.